How do breast implants affect your breast cancer screening? Love this question. I was just at a lecture with a radiologist discussing this very issue. So there's been studies done over the years where they've looked at a variety of different things. Implant placement under and over the muscle, incision location, and the goal was to figure out whether these things can affect your mammography. The main concern here is that over the muscle augmentations, which would be subfascial or subglandular augmentations, could theoretically leave trace amounts, tiny amounts of breast tissue under the implant, and that could be harder to see with mammograms. But like anything theoretical, we need to see it play out in real life. And while that is certainly true, we have not seen women with over-the-muscle implants diagnosed with worse cancers, higher state cancers, or missed cancers compared to under the muscle. So as far as we can see, it doesn't affect real-life mammogram screening. Now, that being said, this radiologist we talked to said with some women, it's harder to see underneath the implant. And the radiologist should look at the image and determine if this is the case. And if this is the case, they're not seeing what they need to see with a mammogram, they should recommend either ultrasound or MRI. And I always think it's really important as a woman with implants that you understand that you have implants, and you need to make sure that your breast imaging can see what it needs to see. So it's never wrong to ask the doctor that ordered the imaging to assure that the radiologist was able to see what they need to see and you don't need anything in addition. And the one thing I'll mention, and I discussed this with the radiologist, is there's a new technology which is VeriScan, which is a breast CT scan. So it's a little different than a traditional CT. It's a CT scan that's just of the breast. And this does a nicer job of seeing under the implant, but it still also sees calcifications similar to mammography. It's not FDA cleared as a screening modality, just as a diagnostic modality, but this may end up being something that's more useful for patients with implants. And it's nice for patients with implants because you don't have to do the additional images that you do, the displacement views, and there's no compression. So that may be an option for you as well. But it's always a concern. You always have to think about these things because breasts like to make cancer, and you want to make sure with your breast augmentation that nothing is happening that could potentially lead to a missed cancer.